Hello YouTube friends, welcome to another segment of Switch the Script. On today's topic we'll be covering why universal healthcare won't work as advertised. Now, what the government is telling us, what both political parties are telling us during this electioneering period is that the universal healthcare system will cover everyone, won't leave anyone behind, and it will offer affordable and quality healthcare. Now, my biggest problem with that, it's not offering solutions to the key problems. The key problems is I can't afford medicine, I can't afford my doctor. So what do I do? And the solution is not offering an insurance plan, which is technically just collecting money and offering a lottery system, because what the biggest problem with the NHIF is you have high-risk individuals, so the elderly and people who actually have those illnesses, and the low-risk individuals, so the youth and people who are healthy, paying the same amount. Now, the biggest problem is we are finding that there are high-risk people who are being covered, yes, but there are these low-risk people who one time they got ill, they are going to hospitals, and the NHIF can only cover a small bit of their bill. And now the other problem will be there are young people who are intentionally high risk. What I mean by that is people who are chronic drinkers, chronic smokers. They have intentionally damaged their body, and they expect when they go to hospital that the government, the NHIF will cover their bills completely. Now, the best solution will be for this young person to take care of their body and let nature take its toll, where when you're old, of course, you're going to be high risk. There are illnesses that may hit you harder than it would when you're younger. Now, for universal healthcare, the biggest problem is trying to offer affordability for all and good quality, because the healthcare can be offered in three ways: good quality for all, and cheap. And you can only pick two, but not all three. No country on earth has been able to offer all three. And what you're going to find is when the government is saying, I'm going to provide healthcare for all, then it will have to ration or deny some people healthcare. That's just how it is. Imagine a table of 5. There is food for a table of 5. Yet you invite your friends, maybe 4 more friends, so now you're 9. What happens to the food? You'll have to ration it equally so everybody gets a piece of that. And that's what's going to happen to a healthcare system, where individuals are going to go to hospital and they are going to have to deal with rationed healthcare. Because if you're going to look at Sweden, you're going to go to look at the UK. Currently, the UK, the NHS, apologies, has been bankrupted because the finances are not enough to cover all these high-risk individuals. Because once you start offering people free healthcare, what you're going to do is you're going to encourage some individuals who would have taken care of their body. Because if, let's say, I'm going to tell you, I'll pay your bills no matter what. So if I'm going to drink myself to death, I'm going to drink myself to death knowing very well that the government will take care of my bills. The only reason right now that we have a healthy nation is because people know when I get ill, if, let's say, I do damage my body, when I get ill, the government will take care of my body or of my bills. I'll have to fork out all this money, which I don't have. So you're finding most people nowadays, they are jogging around. They're trying their best to keep their body fit and probably save enough so when they are old, they can those elderly illnesses, they can take care of that with the finances that they have saved up. And that's the biggest problem that I have with universal healthcare that's going to come soon, and it's going to prolong waiting times in the hospitals. That's a guarantee. That's a guarantee. Look at Sweden, for example. They have a government-run healthcare, and you're not allowed to use your own money to buy medicine. So they have an underground, a black market of these medicines where people will now use their own money to buy it, or they turn themselves to medical tourists where they have to go to India or even to the US to access that healthcare. So when it comes to universal healthcare, I think more research has to be done, and also the mainstream media has to be truthful with what it's covering, because if you look all around the world, look at the longer waiting times and look at how many individuals from that country are turning to medical tourism. And also when you bring up a country like, let's say, Cuba, there is an issue with Cuba where, yes, they do have doctors, but their government is actually pimping them to other countries where you'll have to pay close to $4,000 per head to the government of Cuba, and their doctors are paid close to $10, if I'm not wrong. So that's actually exploiting your workers. So Kenya doesn't have good nurses, I will tell you that. So what I would have liked to know is, how much does the UK pay Kenya to export our nurses to the UK? Yet we have a shortage of doctors and nurses here. Okay, so that's something that you really need to think about when you're bringing the topic of universal healthcare. Okay, let me know in the comments below if I got something wrong. If something sounds off, maybe I can make a follow-up on it. Until next time, that's all.